Good morning, everyone. I am Mark Cyril Elcagatin, your infection control practitioner. For today's lecture, I will be discussing your isolation precautions. To those staff who were able to attend or register the online lecture for chain of infection, I read your messages or your questions on how to prevent the transmission of infection in the hospital. Today's lecture will give you a quick overview on what are the different precautions that we can apply as a healthcare practitioner since prevention of infection is everyone's responsibility. So this will be just a quick overview and we will have a separate discussion. We will be dissecting each component of the topic in a different lecture later on. So what is isolation precaution? Your isolation precaution is also known as your expanded precautions. These are needed to further reduce or prevent the spread of epidemiologically significant or highly transmissible pathogens when standard precautions alone are insufficient. There are two tiers of your isolation precautions. These are your standard precaution and your transmission-based precautions. When we talk about your standard precautions, these are precautions designed to reduce the risk of transmission of microorganisms from both recognized and unrecognized sources of infection in hospitals, meaning to say it's applicable for all. Any patient coming in our hospital, we need to apply your standard precaution. It also applies to blood, all body fluids, secretions and excretions except your sweat regardless of whether they contain blood, non-intact skin, and mucous membranes. We have different components of your standard precautions. Number one of which is we have your hand hygiene. Okay? Your hand hygiene is the single most basic infection prevention and control procedure that we need to apply or we must master in order to prevent transmission of infection in our healthcare institution. The second one is we have wearing of your appropriate personal protective equipment. Now, your PPE serve as your protection from any harmful microorganisms, especially if you're going to perform procedure in the delivery of care towards your patients. The third one is we have your respiratory hygiene or your cough etiquette. Now, in light of the current situation that we are facing right now, we have the COVID-19 pandemic, your respiratory hygiene or your cough etiquette is very important in order to prevent the transmission of any microorganisms coming from yourself towards others. So, meaning to say you are trying to protect the environment or the people that surrounds you. The other one is we have your patient placement. We need to place those patients that poses risk of any transmission or that poses risk of transmitting any infections to other patients in order to limit or to stop or to control the spread of infection in a healthcare institution. Next one is we have your patient care equipment and instruments or devices. We have infection control policy for care of patient equipment and devices or instruments. Because these instruments or devices, especially when it came in contact with patient's blood or body fluids, so those items are considered as contaminated. So we need to have established guidelines in order to clean or disinfect or sterilize those devices, those instruments or equipment. The sixth one is we have your care for the environment. Hospital environment also poses risk of any infection that might be acquired by our patient and any other healthcare providers or practitioners working in a healthcare institution. So it's very important to establish protocols or guidelines in order to clean, disinfect, or decontaminate hospital environment so that we can prevent also the spread of infection coming from those sources. It is very important also that all our chemical for disinfection should be approved by, especially here in Saudi Arabia, from the Ministry of Health or recommended from the Ministry of Health, as well as it is EPA registered disinfectants. Next in line is we have your textiles and your laundries. We should handle used textiles and fabrics with minimum agitation to avoid contamination of air, surfaces, and persons. Next one is we have your safe injection practices. Now, when we talk about safe injection practices, these are practices in which we are going to use aseptic technique to avoid contamination of sterile injection equipment. We do not administer medication from a syringe to multiple patients, even if the needle or cannula on the syringe is changed. Use fluid infusion administration sets for one patient only and dispose appropriately after use. And use single-dose vials for parenteral medication whenever possible. Do not administer medications from single-dose vials or ampules to multiple patients or combine leftover contents for later use. If we are going to use multi-dose vials, both the needle or cannula and syringe used to access the multi-dose vials must be sterile. And do not keep multi-dose vials in the immediate patient care treatment area and store in accordance with the manufacturer's recommendation. Discard if sterility is compromised or questionable. And lastly, do not use bags or bottles of intravenous solutions as a common source of supply for multiple patients. Second to the last is we have the infection control practices for special lumbar puncture procedures. So it is very important to wear a surgical mask when placing a catheter or injecting material into the spinal canal or subdural space. Let's say, for example, during myelograms, lumbar puncture, and spinal or epidural anesthesia. The last component of our standard precaution is we have your worker safety. So the safety of the employee is very important, especially if you are there is a risk of exposure to any bloodborne pathogens, to airborne pathogens. That is why one of our program for the employee health clinic is we do fit testing for staff so that they will be protected in case they will be going to handle patients suspected or confirmed case of any diseases that is transmitted through airborne, as well as we are also giving hepatitis B injection. We are testing the titers of our employee to see if they are protected or if they are immune with any bloodborne special hepatitis B virus. So that is all about your standard precaution as well as its components. So the next tier of our isolation precaution is we have your transmission-based precaution. Your transmission-based precautions, these are precautions that we will be applying in addition to your standard precautions to patients known or suspected of being infected or colonized with an epidemiologically important or highly transmissible pathogen. We have three types of your transmission-based precautions. First is we have your airborne precaution. Your airborne precautions, these are precautions that we are going to apply if the patient is known or suspected to have any diseases that is transmitted through airborne. And we have color codings for these types of your transmission-based precaution. For your airborne, we have blue. So don't forget, airborne, there is blue, airborne B, so it's blue, okay? The next type is we have your color red or pink, which is your droplet precautions. Your droplet precautions, these are precautions that you are going to apply if the patient is known or suspected to have any diseases that is transmitted through droplet, okay? For your droplet, just try to remember there is P and R, so red or pink. There is P and R in the droplet word. So don't forget, it could either be pink or red. But in our policy, it's pink, okay? Although in the picture or in the poster, it's most likely color red. Then the last type of your transmission-based precaution is we have your contact precaution. Now the color for our contact precaution is we have your green. This type of precaution is used if the patient is known or suspected to have any diseases that is transmissible through contact. So we need to apply your contact precaution. We can also apply our contact precaution if our patient has drainage, incontinence, oozing wound, or there is pus oozing. So we can apply contact precautions to those types of patients or cases. As what I have said, from the start of this lecture that we will be dissecting, or we will further enhance our learning with the different types or components of your standard precaution as well as your transmission-based precaution on the next topic or video presentation. These are the references that I use for today's lecture. If you have time, try to check it out. I hope everyone learned something out of this lecture or topic, and I hope that you can apply and you can share this one so that it will be retained in your memory, and try to apply it in your day-to-day activities as a healthcare worker and as a component or a proponent of preventing infection in our healthcare institution. So thank you very much. I hope to see you on the next lecture. God bless.